Okay, we're back with Dr. Gorfinkel, who apparently got the memo regarding pink. Think pink. Yes.
We're all doing it today.
Yes.
I'm not alone. Jeff, you look great.
Well, as do you.
Pink is an underutilized color. I'm a doctor. I'll stay in my own lane. Sorry.
Okay.
Sorry.
This is not a fashion segment. This is health. Okay. Good to talk the latest health headlines as always on a Friday with Dr. being called razor blade throat because it's causing a really severe sore throat.
That is correct. And this particular variant, no one ever even heard of it 5 months ago. And now it makes 2 out of 5 cases in the United States. So this is neck to neck with another variant, which is also similar symptoms. 7 out of 10 individuals who have this, it's called the Nimbus variant, get a sore throat. But it's the usual symptoms which you can't tell. Is it a cold, even allergies, sore throat, runny nose, body aches, fever, loss of sense of smell and taste, cough. So it's the same old symptoms. Good news. It is still sensitive to the vaccines that we have. It keeps people out of hospital, although it does not prevent transmission of the disease. And another piece of good news, it is detectable by the tests we're using.
Okay. All right. That is good news. Let's move to Alberta for a second, because Alberta healthcare workers there are, when it comes to COVID, we're still on the topic, are asking the Premier to reverse a new policy.
Yeah, this is kind of concerning. All of a sudden, the number of people who are eligible for free vaccinations by Alberta Health has vastly shrunk. So now it's people who live in chronic care homes, severely immune compromised, the handicapped, or people on social programs. So who is out? Healthcare workers. Who else doesn't count? Seniors who are living in the community, no matter how many underlying conditions they may have. This is a major change from what was.
Now, the government is saying that they've spent $135 million on unused vaccines.
I'm glad you're pushing back, but here's my pushback to that. How many people are going to be hospitalized as a result of not having access to the vaccines? So if they've got to pay, and I am not kidding, this is the price, $110 out of pocket, what is that going to do if people can't afford it?
Sure.
Because for people who aren't aware, the policy was for people to pay, right? If you're not covered?
The policy moving forward will be to
Pay for a COVID vaccination.
Right.
And to your point, I mean, this could get costly if it comes to hospitalizations, and we see more and more people in the hospital because they have not been vaccinated. All right, I want to talk also about this latest trend dominating TikTok. It's called Sephora Kids, and it's young people using anti-aging products. And there's a new study, Dr.
The latest COVID strain is making itself known in San Diego. The Nimbus variant is spreading rapidly across the U.S., and patients describe throat pain that feels like swallowing razor blades. We're working for you on what you need to know about this latest COVID variant, what to do if you test positive. The newest COVID strain is drawing attention for one brutal symptom.
The nickname is razor blade. It's a razor blade COVID.
I talked to Dr. Ahmed Salem from a waiting room. He's a pulmonologist at Sharp Memorial Hospital and says the excruciating sore throat is the primary symptom of the Nimbus COVID variant.